Good afternoon.
Um, I'm very happy to see you all here this afternoon, especially, of course, our speakers and our moderator and my colleagues who have put this together. Thank you for being with us and for supporting us in this endeavor. And I want to thank all the people that have logged in to participate in this conversation. It's a very important one. My name is Kemi Ogunyemi. I am the director of the Christopher Collady Center for Research in Leadership and Ethics at Lagos Business School. And between the center and the Humanistic Management Network, we have put together this webinar. Obviously, it's an important topic, but one of the things that I wanted to bring to our conversation, to our consideration in welcoming you this afternoon, is the fact that organizations are places where human beings go to interact with one another and to create value. And in that process, depending on the nature of the organization and the culture and climate, the person who goes there may be enriched or impoverished. And this is a concern of the Humanistic Management Network, which is made up of a variety of people working in various circumstances in life, working in varied industries. It's not an association, it's just a network of people who think alike. What brings them together is the concern for human flourishing in workspaces. That concern that organizations should not be a place where people go and they become worse off, neither physically, nor psychologically, nor mentally. The workplace should not be a place that destroys people and therefore destroys society. So anything that could encourage organizations to do better in this regard, I think will always be welcome, because we all can find resonance in that ideal of having a workspace where people can go and their dignity can be respected, their flourishing can be promoted. So we have very knowledgeable speakers to talk to us today about occupational health and safety in the workplace in the wake of COVID-19. I'm going to introduce the moderator who will take over from here. Thank you once again to everybody for joining us. Our moderator today is Sofiat Busaria Kimbodi, and she's an assistant lecturer in the Department of Social Work at the University of Lagos. Sofiat has a bachelor's degree in social work, a master's degree in sociology from the same university, University of Lagos. She has worked as an assistant community development officer in a local council development area and has conducted research in all kinds of areas. I was impressed when I saw the things that Sophia has engaged in researching. So for example, she has done research in the area of crime and deviance, in community development and disaster social work. Right now, she's doing her PhD. She's in the process of doing her PhD at the University of Benin. So thank you for Sophia for moderating the panel, and let's get on with it.
Right.
Thank
Thank
you.
you, Mrs. Kemi Ogunyemi. I'm glad to be part of this event. I want to start by appreciating the Christopher Collady Center for Research and Leadership and Ethics for organizing this webinar, particularly for deciding to educate the public on occupational health and safety in relation to COVID-19 pandemic. I'm sure you'll all agree with me that this is a timely topic, because all over the world, countries are gradually opening up their economy, and industries, schools, agencies are also opening up without any generally approved vaccine for COVID-19 yet. And this means that we all need to be equipped with the knowledge of how to remain safe and curb the spread of this virus. More so, employers, employees, and the general public must be educated on the measures to put in place to ensure safety without undermining productivity. Hence the importance of this topic. So I would want to quickly give a brief of how this webinar is structured. First, I'll start by introducing to us our keynote speaker, who will then give us the keynote address. After which I'll take a few questions from the audience, and then I'll advise that we jot down our questions as we listen to the keynote speaker. Then I will introduce to us our panelists. We will share their knowledge and experiences on occupational health and safety with us. Then finally, we'll take the other questions that we have towards the end of the event. So without wasting time, I want to introduce to us and present our keynote speaker, the person of Dr. Lanre Ogunyemi, for the keynote address. Dr. Lanre Ogunyemi is a consultant in occupational medicine and the medical director for Trinity Occupational and Public Health Solutions Limited. He has been a registered medical practitioner since 1994 and listed on the General Medical Council Specialist Register for Occupational Medicine since 2006. He is also a visiting lecturer to the University of Birmingham, Institute of Occupational and Environmental Medicine, and currently the chief examiner for the MFOM exam of the Faculty of Occupational Medicine. He is the regional specialty advisor on behalf of the Faculty of Occupational Medicine for Trent Region. He is the chair for the East Midlands group of the Society of Occupational Medicine and leads a bi-monthly continuing professional development educational event at the University of Nottingham for members of the society. He is a fellow of several medical colleges, including the faculties of Occupational Medicine in London and Ireland, the American College of Occupational and Environmental Medicine, the Royal College of Physicians of Ireland, and the Royal College of Surgeons of Edinburgh. Please join me as I welcome Dr. Lanre Ogunyemi to give the keynote address. Dr. Ogunyemi, you're welcome. Please, you have 20 minutes to do this. Thank you.
Thank you very much. I'm just going to try and share my screen. Thank you for that excellent introduction. Hopefully someone can tell me if we can see that.
Yeah, sure,
Yes, we can.
Okay, thank you. I'm a consultant in occupational medicine and I practice as in East Midlands. I look after quite a few industries which spread from the fire service, the manufacturing industry for cars, the healthcare services, the railway, transport, and food manufacturing. So quite a varied panoply of employers that I have been involved in supporting through this COVID pandemic. I've just selected a few things that are mainly from my own experience of the pandemic to talk about. It's a brief overview, and please forgive me if it does not go into detail on some of the things that we might be interested in, but I hope the panel discussion will be able to mop up any areas that you might be interested in, which I may not have covered. Now, so what is occupational health? People often ask me, we're kind of the lost brothers when it comes to medicine. Occupational medicine mainly deals with the interface between health and work. And occupational safety and health is a multidisciplinary field that is concerned with the safety, health, and welfare of people in various occupations. So in my jobbing day, I will be seeing people who have been off sick for various reasons and for which the employer wants advice on how best to get them back into work. And also be providing strategic advice to employers on how best to manage the health of their employees. The reason we're all talking today is because of this virus, coronavirus. It's a picture that a lot of people will now be familiar with, the diagrammatic representation of the virus. As an introduction, I will talk a little bit first about COVID-19, which in full means coronavirus disease 2019. It's caused by one of the coronaviruses, the one that I showed before, the typical round appearance of the coronavirus. And it was declared a pandemic by the World Health Organization in early March. That means it was of epidemic proportions in multiple countries. The main thing about it is that it causes severe illness and death via sustained person-to-person spread. And how is it spread? Through droplets, aerosol, or contact. Droplet refers to respiratory secretions from coughing or sneezing, landing on people's nose, mouth, or ears, as well as it can stay suspended in air for some time, which is part of the reason why it is so contagious. But it can also spread through surfaces where it has landed on and which have not been thoroughly cleaned and have therefore been contaminated. So it has various modes of spread and has proven to be highly contagious. The hallmark, there's several symptoms, but these are the key ones that we tend to be worried about: fever, cough, shortness of breath, and loss of sense of smell and taste. Those are the ones that are relied on locally to make a diagnosis of COVID. There are a number of other symptoms which tend to go along with COVID-19 disease. It's key that, as mentioned before, there's no vaccine yet. There's no specific treatment that we know to cure the disease. There are treatments that have been found helpful and which have succeeded in prolonging lives. But at the moment, there's no magic bullet for COVID-19. So the main way that we try and manage it is to prevent coming into contact with it. That is preventing getting exposed to the virus. The other key thing, which is a song and dance for us in occupational medicine, is to be aware that there are certain vulnerable groups of people where if they get COVID-19, there's a high likelihood that they could die from COVID-19. The main way that it has been controlled all over the world is through national or regional lockdowns. All this is aimed at limiting the exposure of various of people to the virus. And this has included whether it's business closures or border closures, airports being closed down, or quarantine measures. If you can think back when this first became big news was when Wuhan went into quarantine, and it was amazing for anyone in public health field that a whole city could be quarantined as effectively as the Chinese were able to do. But despite that, it escaped to the rest of the world, which is just a pure reality of the way globalization is at the moment, that it's very difficult to keep any contagious disease localized to wherever it arises. And then there were travel bans, curfews, and other recreational and social restrictions. Countries have adopted this into very different combinations and to different degrees. But that's the way it's been managed thus far. As of yesterday, I looked up the cases of COVID-19. So nearly 47 million cases worldwide, with the top 5 being USA, India, Brazil, Russia, and Spain. Nigeria still has very few cases. When you compare our population, is still just about 302 per million, whereas the UK is 15,218 per million. So there's still very few cases in Nigeria, and that is replicated over most African countries. The reasons why are not fully understood. And the proportions are similar in terms of death. Worldwide, there's just it's 1.2 million deaths as of yesterday. In the UK, 47,000. And in Nigeria, just over 1,000 deaths have been reported thus far. So, but there's still potentially a very long way to go with the disease. Yesterday, the UK went into another national lockdown. If one thinks back to 100 years ago, the Spanish flu ended up killing about 50 million people. So one still has to be very worried about how things could go with COVID-19, despite all the developments that have been made so far. Now, the focus of the talk is about coronavirus as an occupational hazard. For those who may not be familiar with our terms in occupational medicine, a hazard refers to something that can cause harm, and the risk refers to the likelihood of harm arising from the hazard. Coronavirus is a biological agent which can cause harm to the worker's health, and therefore it is recognized as an occupational hazard. Over here, it is on the list of, when I say over here, I mean the UK, of reportable diseases where there is clear evidence that it has arisen as a result of exposure from work. It can be introduced into the workplace by workers. If you remember, we said how it's transmitted quite often person to person, but also from contaminated objects. So if you're in any job that involves interacting with the general public or even commingling with your fellow employees, then you could easily come into contact with COVID-19 being such a widespread disease within the community. There are a few key things in terms of workers' health and safety that I think worthy of mention. One is the principle that employees should be aware of risk and hazards that might be occurring where they're working. And this mainly relies on ensuring that people have adequate education and information. So some of the things that I've just discussed about COVID-19 ought to be widespread knowledge for any employer, and there's the sort of information that any employer should try and make sure the employees are aware of, what the disease symptoms are, how it is spread, and the main ways in which it can be prevented. So one would expect that to be kind of standard fare for most employers now. Also, we would expect employers to undertake risk assessments, which I will talk a little bit more in detail about, and also to look at how best to manage the risk of employees developing COVID-19 and thereby control the exposures. All these tends to be underpinned by legislation. In the UK, the primary legislation is something called the Health and Safety at Work Act, and all countries have similar legislation to protect workers' health from harm that they could be exposed to in the course of their work. In Nigeria, it's the Factories Act, which there are 1987 iterations, then back in 2004. And I think we also have labor laws that underpin the employer's responsibility to manage the risk of their employees coming into contact with COVID-19 and thereby ensure that they do not come to harm through their work. So all the above are principles which kind of govern how you should try to look at an employee's health in the context of COVID-19. So I distilled three things that we tend to focus on in terms of workplace risk assessments. There's a lot of detail that one can go into in terms of how to analyze each one of these things. But the main principle that have been coming across is for whichever workplace you are, trying to correctly analyze the risk of exposure. By that, I mean the risk that somebody in their work might end up coming into contact with COVID-19. This will be different for different workplaces. So someone who is a hospital doctor in intensive care is at high risk because they'll be seeing people who are very unwell. If you're a mortician or somebody working in the morgue, you might be seeing people who have died from COVID-19 and you may be at very high risk of exposure. Also, if you're working with the public, if you're a cashier or receptionist, then you might be at medium risk because you might be seeing people who are possibly well or, the sort of walking wounded, as it were, who are carrying the disease. Of course, if you're in a role where you're just in a back office and you don't get to see anybody, then the risk of exposure is very low. And alongside the risk of exposure, one has to consider the various tasks that the employee might be undertaking, and then look at each task and say, okay, what are the risks of exposures associated with that? So a huge principle in terms of doing workplace risk assessments is correctly analyzing the risk of exposure to the illness. The other principle that in terms of a separate category of risk assessments is the likely severity of illness. I will talk a little bit more about this, but this refers to, should the employee contract COVID-19, how unwell will they fall because of this? So how bad will they suffer from the illness? And there's a lot that also goes into analyzing those risks, which I will touch on in a bit. And the final risk assessment, which I normally encourage businesses to do as well, is that whatever preventive and protective measures that they're putting in place, you need to look at the potential risks of that. During the lockdown, a lot of people have been sent home, and I've seen a lot of patients who perhaps the work interactions have been key in terms of preserving their mental health, and then they've been cooped up at home for some time, and their mental resilience has been overwhelmed during this period of lockdown. So mental health has been a big one in terms of response to COVID-19. That is just one of the examples in terms of how the mental health pressures have come through, but there's also the other bits in terms of just the adverse news that you keep getting every day. Alongside that, also, some people might be getting exposed to new cleaning agents at work, which they had not been before. And sometimes you have toxicity arising from those. So sometimes you have to think laterally as well. We're putting in this measure, is there likely to be any risk of harm because of the measure that you're now introducing into the workplace? So those are kind of the bullet points that I normally ask an employer to look at. Risk of exposure to COVID-19 in the first place. If their workers get unwell, how bad will the illness be? And whatever preventive and protective measures are put in the workplace. How are there any unanticipated risks that may be arising from that? A key principle for us in occupational health and safety is to have a hierarchy of controls. So whenever we do the risk assessment in terms of managing the risk, the best thing that you can look for is something that totally eliminates the hazard. And then the final last port of call is personal protective equipment. So that diagram I have there just shows that hierarchy of control, preferably something that removes the risk entirely. As an example, back in March, there's a test which we normally do for lung function in occupational medicine, and that involves the employees blowing into a device to try and measure how well their lung is functioning. Of course, we know when somebody blows, you're blowing out air and thereby generating droplets and aerosol. So across the country, that was more or less banned, and nobody was undertaking spirometry anymore, those type of lung function tests. Generally, in some cases where it is key to do some kind of assessment, that particular test was substituted for something else to give an idea of the person's lung function, whether it's to get them running up and down the stairs until they can't do some sort of exercise tolerance test as a substitution for the lung function test you will normally do. So one can walk through that hierarchy of controls to try to see what best control might be appropriate for the risk that you have identified from your risk assessment. So those two things tend to go hand in hand and key in terms of managing any workplace problem. So we do a comprehensive risk assessment, and then you look at the hierarchy of control measures, starting from whether it can be eliminated, whether it can be substituted, whether there's any way you can change the way you work in order to try and manage the risk. And when all that fails, whether there is any protection that you can then offer in terms of garments or equipment to minimize the likelihood of the person being exposed to the harmful agent. So the common measures that have been adopted for managing these risks of exposure to COVID-19 at work has tended to be the physical distancing measures, hygiene measures, wearing a mask, making sure that people have sanitary facilities at home, having instructions everywhere that, okay, before you enter the premises, you've got to sanitize, you've got to wear a mask, and also training people and making sure they're very well aware of the risks that accompany COVID-19. All the workplaces that I look after, the moment I get in, you see huge posters about COVID-19. You see markings on the floor to make sure that people are socially distant. And you find, places like laboratories where they've closed off cubicles to try and ensure the social distancing arrangement. So these things have to be done in great detail to try and manage the risk of exposures at work, and in order to make your workplace COVID secure, which is a term that our government has become kind of fond of in the UK, COVID secure workplaces. Another aspect tends to be health surveillance mechanisms. So those are things such as you checking on somebody's health regularly, they're completing questionnaires all the time to make sure they do not have any of those symptoms that we've already identified are common with COVID. And also they're aware of what they need to do should they have the symptoms, whether it's self-isolate and how long they need to be free of fevers or cough before they can come back into the workplace. And the last sort of exposure or control measure tends to be personal protective equipment. So as a doctor, if you needed to examine somebody, you would need to make sure that you have appropriate personal protective equipment. And for us, that will be, you have to have face and eye protection, make sure that you have gloves that are appropriate, you're fully gowned, and you have the correct type of respirators. Respirators refer to the mask type devices. They look like masks, but they have to fit very well on the face, and they have different filtration properties with a minimum filtration property that is normally recommended for COVID-19 of N95. So the other thing I thought I would just quickly mention as well was testing, which there's a lot of confusion about it out there. The commonest test that's used at the moment for COVID-19 is a PCR test, which tests the virus. It's actually testing the genetic material of the virus. That's different from antigen tests, which are not quite as sensitive, and also very different from antibody tests, which measure the immune response. But the PCR tests, once positive, you can still have false negatives, but it tends to stay positive for quite some time. So even after somebody is no longer at risk, sometimes they can still be testing positive. And I get a lot of inquiries about trying to interpret testing. I had mentioned about the vulnerability issues. If you have older workers, obese workers, or workers with chronic diseases, then you have to be a lot more careful about their being in the workplace so as to protect them from the exposure to COVID-19. So that forms an inherent part of the risk assessment that I tend to do in a day-to-day work in terms of managing and supporting employers who have workers working during this pandemic. The key summary things that I wanted to mention as my message is it's important for employers to have robust risk assessments. It's important that indirect risks such as mental health impairment are not overlooked. And I would, being an occupational physician, I will strongly advocate that you use occupational health services to help manage this type of risk for your employees. And also following the pandemic, occupational health services can help with the post-pandemic recovery. So I always try to end every slide with, every time I talk with this, I see workers as like the goose that lays the golden eggs for any business. And it is key for a business to take optimum care of this goose if they wish to continue being productive. So I always encourage employers, it will mean that one, they show they're caring employee. It will also tend to mean that they have more productive employees by doing their utmost for the employees. But over here in the UK and in a lot of developed countries where the law is very, very is a lot more proactive, it means they also stay on the right side of the law. So look after your workers. There's some resources there. There's a Society of Occupational and Occupational and Environmental Health Physicians of Nigeria, who have a website, and I have been quite involved with them. I'm also a member of that society. Sorry, that wasn't in my intro, but they are a good resource locally in Nigeria for anyone who is looking for occupational health support. The others are simply some of my favorite resources that anyone can Google for supporting employers in terms of answering some of the questions that are arising from COVID. The Alama one mainly deals with the vulnerability issue that I discussed. So thank you all. I think there's a very slight overrun in my time, but apologies for that. Thank you.
Thank you very much, Dr. Ogunyemi, for that insightful and well-delivered lecture. Thank you. I'm sure we all have gained immensely from his lecture, and particularly on the likely risk that employees might be exposed to, and how to manage this risk. Thank you very much. So now I'm sure that we might have one or two questions for Dr. Ogunyemi. So like I said earlier, I'll be taking the questions just after his address. You can start sending your questions.
Can I stop? Sorry, can I stop the sharing, or would you like that to stay on?
Well, you can stop it.
Okay, thank you.
Yeah. So do you have any question for Dr. Ogunyemi, please? Quickly. Okay. So if there are no questions, I want to ask a question. You've told us about how other countries are keen in ensuring occupational safety or the safety of their employees. But here in Nigeria, I don't know if it's that serious, because there's this common notion that we are kind of immune to this virus here in Nigeria, probably because of our hot weather condition. So although that has not been proven scientifically yet, but then when you compare the level of positive cases here in Nigeria and in European countries, I think to some extent, there might be some level of truth in that. So how seriously do you think industries or organizations here in Nigeria should take these safety protocols? How serious do you think they should take them? Thank you.
Thank you. I think that's an excellent question. First, in terms of there's a strong legal obligation in the UK and the US and other countries, which the law exists in Nigeria, but it's not as rigorously enforced. In terms of the harm that can arise from coronavirus, we're not sure exactly why the cases are not as widespread in Nigeria and the rest of Africa, and the deaths as well. If you remember the slide that I showed, the death rate per million population in Nigeria, the reported death rate is about 1% of that in the UK. Even though we know that there might be underreporting, it seems unlikely that that will be responsible for all of that. Some of the things that we think might be contributing to that is, if you look at the age group, the median age for people in whether it's Nigeria or Africa generally compared with the UK, it's very different. So there's a huge older population in a lot of the developed countries, whereas in Nigeria, I think last time I checked was about 18. So you have a lot of young people there, and we know that the virus behaves differently with younger people compared with older people. The other thing as well is that we know that the virus mutates. One is not certain about this, so it may be that the way the virus is actually acting at the moment in Africa, there's a mutation of it that is making it cause less harm. But as an example as well, we're going through what's being termed as a second wave at the moment in the UK. And the data I imagine from that second wave is that whereas it was thought that females, for example, between 18 and 49 were less affected, Compared with the first wave, those females are now 4 times as more affected. So we think the virus is mutating as well. In this instance, the example I've just given is causing more harm. So I don't think there's any excuse for Africa or Nigeria to be complacent, because even though it may not be as virulent at the moment, there's every possibility for it to become even more dangerous going on, which is some of what they are already seeing here. So there are a lot of other things that we think might be contributing. There's widespread, usage of different drugs in Nigeria, so there may be some impact of that. And also we have a lot of other viruses that may be competing and maybe offering a protective effect. So it's difficult to understand exactly why it's so low within Africa and Nigeria, but there's no excuse for complacency despite that.
All right, thank you very much for that concise response. There's another question here from Margaret, but I'm trying to assess the question. Please, Margaret, you can type in your message again and resend. Thank you. So moving on, I'd like to introduce our panelists to us, the persons of Dr. Odubanjo and Dr. Eniola Olubukola Cadmus, to share their views and experiences with us on operational health and safety in Nigeria. I'll be starting with Dr. Doyin Odubanjo. Dr. Doyin Odubanjo is the chairman of the African chapter of the International Network for Government Science Advice. He is also the executive secretary of the Nigerian Academy of Science and immediate past chairman of the Association of Public Health Physicians of Nigeria, the Lagos chapter. Dr. Odubanjo is an advisor to the Center for Palliative Care Nigeria and serves on the board of the West African Office of the Conversation Africa. He was a member of the Committee on Enhancing Global Health Security through International Biosecurity and Health Engagement Programs of the National Academies of Science, Engineering, and Medicine, formerly U.S. National. Dr. Odubanjo, as part of a newly recruited team, was instrumental to a successful transition of the Nigerian Academy of Science from a largely honorific organization to one that provides evidence-informed advice to government and other stakeholders. This happened within the African Science Academies Development Initiative of the U.S. National Academies, now NASEM. In the last several years, he has collaborated with various academies globally and the network of African Science Academies on diverse projects aimed at informing policy. In the Nigerian Academy, he has received and successfully managed grants from various US-based institutions, including the US Department of State, Ford Foundation, Rockefeller Foundation, and the US Civilian Research and Development Foundation. Together, please let's welcome Dr. Doyin Odubanjo. Dr. Odubanjo, you're welcome. So our second and final panelist is Dr. Eniola Olubukola Cadmus. Dr. Eniola Olubukola Cadmus obtained a medical degree from the University of Ibadan, Oyo State, Nigeria. She obtained a master's degree in public health from both the University of Ibadan, Community Medicine, and the University of Pretoria, Health Promotion with specific emphasis in tobacco control. She is a fellow of the West African College of Physicians. She is presently a lecturer in the Department of Community Medicine at the University of Ibadan. She is also a consultant community physician, both to the University College Hospital Ibadan, as well as the Geriatric Center, as well as the first purpose-built facility for the care of older persons in Nigeria, the Chief Tony Aneni Geriatric Center. Dr. Cadmus's main research interests lie in the areas of healthy aging and its determinants, provision of long-term care for older persons, tobacco control, cessation support and advocacy, as well as behavioral change communication. Let's welcome Dr. Eniola Olubukola Cadmus to this event. You're welcome, Dr. Cadmus. So having introduced our panelists to us, we'll move on quickly to directing our questions to them. I'll be starting with Dr. Doyin Odubanjo. Dr. Odubanjo, In the light of the various international and national occupational health and safety standards, which occupational health and safety standards apply to employer protection of employees during the COVID-19 pandemic? You have 2 minutes to respond. Thank you. Do you have Dr. Odubanjo? Dr. Odubanjo?
Sorry, Dr. Odubanjo is still on mute.
Oh, okay.
So he needs to unmute himself. He's trying to respond, but he needs to unmute himself.
Okay, we'll wait for like a minute or two.
Sorry, we were not being allowed to unmute ourselves by the hosts. So my apologies for that. And I must thank also thank the hosts for the invitation. Thank Dr. Oguyemi for the brilliant presentation as an occupational health specialist. And glad to be speaking with my sister and friend of many, many, many decades, Dr. Cadmus. So but the question again is that what standards should we uphold? The truth of the matter is that COVID-19 in particular, is throwing up something new. And that's why we have so much commotion. You know, people have oftentimes wondered why is there, all the lockdowns and why are things happening the way they are. Some have pointed out that the fatality rate, like we just heard, is just running around between 1% and 3%. So why in the world do we have this chaos? And the truth is that it's simply because we're dealing with something new. And so everybody is having to learn at the go to say, look, what do we really do with this? How is this going to behave? And I think many of those things have been thrown up already in one form or the other by Dr. Oguyemi, thankfully. So the questions that it's throwing up also then touches on what you're asking about the standards, meaning that really this is something that you have to decide, apart from what we know and the basic things that he's been talking about workplace safety. What I also, even from the perspective of the Academy of Science and even INGSA that you mentioned, Network of Government Science Advice, one of the main things that we have been pushing and have particularly been speaking to some of the government authorities about, I must say that I'm not too satisfied with the response yet, is to say many of the things have to be locally driven. You'll have to design things anew. You cannot do things the way they've always been done, and you cannot wait for somebody to tell you how to do it. So we talk about something we call evidence-informed policy making, meaning that you have to do your research, and in this case, we're emphasizing local research, because again, there are questions we can't quite answer definitively yet. So for instance, when it talks about, why is it behaving differently, seemingly here in Africa than other places, nobody can answer that for you adequately. The best way you get your answer is get it yourself, and therefore begin to design the standards and the responses that you need to have. When you have something new like this that comes on board, what it tells you is that you need to check your systems, check what you already have in place and modify. You cannot stay by something that already exists. You have to modify what you have, in order to deal with it. Because what this is also showing us is that whatever we had in place was not adequate to stop it. Therefore, it raises or it begs the question of innovation. We must innovate at this point. I don't want to go too long, so I'll stop at that. I hope I've answered the question sufficiently.
Yeah, thank you, Dr. Odubanjo. But then, how soon should it take, or how long should it take rather? How long should the innovation and research take? Because this COVID-19 has been on for several months, and I don't think we should be able to wait forever before coming up with our own standards to prevent its spread.
Well, it's as fast as it can be without compromising quality. Because for instance, I'll use the example of vaccine development that's going on now, and there's a rush to develop vaccines. One of the articles I was reading over the weekend is the challenges coming up with this desire to rush to develop something, and the fact that in doing that are certain standards being compromised already, even in the US. That's what the article was actually about. about certain things have been short-circuited, and the fact that in some of the advisory committees they have insisted that they will not allow them to short-circuit some other processes, saying that there's only one chance to get this right. If you get it wrong, the repercussions will be terrible, and you have to get it right. So you want to move quickly enough. And like I said, some of the conversations that we've had along these lines have happened from 4 or 5 months ago. Some of the responses are not adequate because if we had started then, we'll have certain answers now. You know, but if the best time to start, of course, is to start right away also, even if you haven't done something yet, start right away. So if you need to research, for instance, into mutation of viruses, if you haven't done it before, start doing it now. Because again, we don't know about the natural history of this virus, is the new thing. So start working on it now in order to have your answers hopefully available if this were to throw you a sudden surprise tomorrow.
Thank you very much, Dr. Ogupad. We have another question here for you. Are there any COVID-19 training resources for employers? And if there are, what topics do you think employers should cover in training the employees?
Well, I'll go with the resources just again, as mentioned by Dr. Ogupad. WHO has some resources also. I mean, well, I think you also already mentioned that on their website. There are some that we've been working with, or we've had some conversations with the Smithsonian Institute in the US that had worked on certain resources for school children, you know, which again are the kind of areas where people will not deal with. We are talking about employers, but I see certain questions about schools coming up here, you know. So there are certain resources about what to do with schools, and that one of the best ways is to work with the children, you know, and in fact, not even the employers. So you get resources from, I mean, sites like the WHO, you get resources from places like the Smithsonian, which is looking at that complex area of schools and schooling. And it's looking at it from the angle of your best effective method, perhaps, is to work with those children because then you can make the school safe, not just the school itself, you also can make the home safe because the children know what to do and will influence what happens at home.
All right. Thank you. So when Dr. Oguyemi was speaking, he mentioned the fact that people could be exposed to different cleaning agents, and it might also be a risk to them. So what are the proper means of cleaning and disinfecting the workplace?
Well, a simple thing to use would be your bleach, diluted in the right way. You know, that would be a very simple agent to use. You can also use alcohol-based agents, up to 70% alcohol. But a simple agent is just the bleach we use regularly. And I call it simple because most people have that at home. You know, so once diluted appropriately, 0.1%, 1 to about 50 parts, and use that to clean, then it shouldn't give much trouble to most people. You know, most people should be fine with that.
All right. So as regards face mask, we've been exposed to different kinds of face masks. We have the clothes mask, the clothes face mask, the surgical mask, and respirators. Can you please share with us the difference or differences among these forms of mask?
Well, basically, it's about the efficiency or the efficiency in prevention of inhalation, particularly of microorganisms, and in this case, viruses. You know, so that's what you are concerned about. So when you start looking at the ones really the N95, K95, that's how you start coming to the surgical mask, and then you come down to your cloth mask, which basically also came into question this time around because of the scarcities being experienced. You know, so the surgical and the other ones, K95 and 95, are actually things that you will use in a hospital environment, you know, where there's a very high risk of infection. And in order not to, because what happened at the very beginning was that we had a sudden high demand. But people knew, oh, this is the best one. So there was a sudden high demand, and that high demand ensured that there was scarcity. So in the isolation centers and the hospitals, it was difficult now to provide for the high-risk individuals who are attending to COVID patients. Cost went up and all that. And that's when also the innovation of you could use a cloth mask. It doesn't mean the cloth mask is not useful. It is useful, particularly because it helps, it ensures that whatever comes out of that person is absorbed by the mask. It doesn't go into the atmosphere. So, and that's why the encouragement for the cloth mask particularly also is that everybody needs to wear the mask. You know, so if everybody wear a mask where they were, then whatever is coming out of every individual, if they had the virus, most likely will not get in the atmosphere. However, the mask also, whatever type it is not the only way. So people also thought, well, if I wear a mask, that's the end of the matter. I can do whatever, I can go to Owambes, I can, you know, just live my life as I wish. And that's not all. You'll have to, I mean, again, engage in the other things that have been spoken about, which is ensure your physical distance. They call it social, but I prefer physical actually. Your physical distance, which is also simple in that if I sneezed and all that, and you were a little further away from me, even if it reaches you, it will be a lower dose of whatever came out of me that gets to you. You know, so that also needs to be applied. And of course, your regular hand washing. So if you were to touch something that's contaminated, but you wash your hand frequently, you are likely to wash it off before you introduce it to your eyes, nose, mouth, or whatever.
Okay, thank you very much. So now knowing that use of face mask is not the only way to prevent or to curb the spread of COVID-19, do you think that employers should still ensure proper social distancing when their employees use closed face mask?
Absolutely. I think you see that there's something spoken about, which I think I like simple stuff, you know, and there's something spoken about which they talk about the 3 C's, you know, which is you have to avoid crowds if you are looking at prevention, avoid crowds, avoid close contact, which is now that physical distance. So you avoid close contact and then avoid confined spaces. So if you look at the work environment, then you apply that to that work environment. How do we avoid, you know, the distance, therefore, would apply to people saying not all employees should come in on a particular day. At our office at the point, we worked on alternate days. So you are allowed to come to the office on alternate days. In some offices, you're allowed to come in only when you are preaching, say you need to come in for a certain reason. Otherwise, you can't just go in to the office. So the idea is to reduce the crowd so that you can have more space between the people at work on the day. So it's still important to ensure that, because like I said, most of the masks, even the best of them, even just by human error, might not be 100% protective, no matter what is written or said about it. In fact, the highest of them will talk about them, I mean, over 95% protection and all that. But again, by human error or sizing, you wear it is not the right size and all that, it leaves gaps for infections. But the more you apply multiple prevention methods, the better off you are.
All right. Thank you very much. We really appreciate your responses. Thank you very much. So moving on, I would like to direct the rest of the questions to Dr. Eniola Cadmus. Dr. Cadmus, can you hear me?
Yes, I can.
Oh, all right. So we want to know the likely physical effects of COVID-19 on the employee, both in the short and the long run.
All right. First, let me thank the organizers for inviting me and for putting me among giants. I'm wondering what you expect me to do between Dr. Ogunyemi and Dr. Udubanjo, but thank you for the opportunity. So your question was the likely effects, long-term and short-term. As has already been emphasized, we're still trying to unravel the story. You know, in many high-income countries where they've had the worst onslaughts, their mental health issues has already been emphasized. Their
especially in terms of anxiety, depression, paranoia, the fear of death has been really horrible. Some have said that there's some form of permanent brain damage, but of course, like we're saying, we still don't have the full picture. So all we can do is wait and see. But we won't be careless or complacent, as has already been emphasized, and so we'll do all that we can to keep people, especially workers, away from harm. Do remember that there's a effect of work on health and health on work. If you are healthy, you're able to do your work well. And if you do your work well, then it has emotional, social, and all other health benefits. But the thing is, and this we can't say enough, is to ensure prevention. But in terms of knowing the full spectrum of what um, the disease is capable of, nobody can beat their hand to their chest and tell you that we know the full picture. The only full thing that we know about is death, and of course nobody wants to have that conversation and nobody wants to think in that regard. But there's a lot of sequelae to the infection which we're still unraveling.
Thank you very much. You mentioned some effects like depression, anxiety, amongst others. So how do you think these effects could be managed or reduced to the barest minimum?
All right. So basically, if you provide the necessary information, okay, if you health educate, providing the information at the right time, the right place, the right media, and then you make people understand the importance of adopting many of these preventive measures, then you would get a headway. But the problem is, right now in Nigeria, I can tell you that the trust is really low among the general public. Okay, they really don't believe. Many people still think it's an American problem or it's a problem of the high income countries, which is not so. And this is partly on our fault from the policies and trying to pass across the information. But the thing is, well, we won't stop trying that which we can, but by and large, if you provide information, if you know what's coming towards you, then you can get rid of the unfounded fears. Unfortunately, in countries like Nigeria, where we do not rely solely on psychologists or mental health issues are still highly stigmatized, then we have to rely on substitutes. Take, for instance, we're a very religious country. And so if the religious bodies, our pastors, our imams, if they have the right information, they can pass the information across. We're a very religious country, and so we end up having hope that, okay, if there's a greater being there, he will protect us. But you and I know that that's not enough. But if you identify the fears and you allow people, or you encourage them or assist them to face those fears, then they wouldn't come. Take, for instance, if an individual knows he has multiple morbidity and is more prone, such an individual will more likely take your advice and your preventive measures seriously. But the problem is, I'm sure if you go on the streets and you ask anybody, they know the strategies, but are we using our face masks properly? Some use the face mask, as I put it, half-mast, covering only the mouth. No, you have to cover even the nose and the mouth because they're all connected. I remember once I was asked to come and give a speech, some health education in church, and I took a broad snapshot of the parishioners, and I noticed that quite a number of people had it on their chin or beneath their noses, and and by the time I finished, you could just see people slowly drawing it back. And I think I've noticed better involvement and participation. So apart from the doctors, you still need the community experts, you know, the community physicians. You still need the health educators, you know, because if people know what to do, then they're more likely to do it. Take, for instance, this face mask. I'm tired of this conversation. Oh, which is more efficient? Just use one. Okay, if you use it properly, like Dr. Odubanjo has said, if I use even the list of them, which is the cloth face mask, and you use it, we all end up reducing our risk. Okay, so why do people behave the way they do? One, if you need to find out if they perceive the disease as serious. You know, that's the perceived severity of the disease. If they don't perceive it as serious, which is the problem in Nigeria right now, many people won't adopt your behavioral change innovations. If they perceive themselves as susceptible, you know, so, okay, you've said, oh, it's the old people that are dying. Oh, so the young people are going everywhere, going to their nightclubs and continuing with their lives, you know, and they've forgotten that they will go out and then bring back the disease, you know, bring the infection and yes.
I'd like to stop here because of time. Yeah, but looking at...
Okay, sorry about that.
No problem. Now that the pandemic is rife and there's a lot of changes in the pattern of work. More people have been asked to work from home. You know, people sit down for long hours. There's strain on the system. These are some of the physical effects COVID is having on people. What do you think people should do to manage these effects?
All right. The first thing is, when you ask people to stay at home, then I hope you are going to assure them of their full pay. If you cannot assure them of the full pay, then I'm afraid people will find ways of coming to work. Okay? So that's the first thing. If you tell them to stay away, or you tell them all to come to work, for instance, then you have to put in place all that they need. So managing the strain, the first thing is if you must safeguard their financial security, and then provide all the necessary interventions to keep them safe. I hope that has answered the question.
Yeah, so but you could buttress more on ways to ensure that people remain fit, despite the fact that they sit down for long hours working on their systems. What do you think people should do to avoid this kind of problems?
All right, it still boils down to the health education. You have to educate them about the need to maintain physical activity. You can set timers and get up from your desk every 30 minutes or 45 minutes. You can ensure that you are not sedentary in the evening, go for the usual recommended 30 minutes walk. But basically, if they know what to do and you have support such as the timers and the gadgets that we all wear about, like the pedometer, your phones, even your phones can assist you to measure your level of activity. But you have to emphasize the importance of staying active so that you don't end up getting ill as a result of sedentary lifestyle.
All right. Thank you very much. So finally, we'd like to know if there is a correlation between the well-being of employee and the community which they serve. Is there a relationship between employees' well-being and that of the larger community?
Yes, there is. If, like I said, there's an effect of work on health and health on work. If I'm healthy, I can do my work well and earn the money, you know. And then if I earn the money, I can take care of the family and contribute my quota to the society. So by and large, everything dovetails into, you know, so it's layered. So if I'm healthy at work, I can take care of my family and then do the necessary things in the community. So they affect each other, so to speak.
All right. Thank you very much, Dr. Cadmus, for those brilliant responses. We're grateful.
You're welcome.
So I'll be going back to questions from our audience.
And I chip into that a little?
Okay, quickly.
No, it's just also a big concern because I've seen some of my neighbors working from home, and for hours they are having meetings. And I've had to say, no, you need to talk to your manager that you can't sit down like this and have hours. I mean, meetings that last for 3, 4, 5 hours. That it is not good. You've already lost out in the fact that you don't get up in the morning to dress up and work sometimes, whether by whatever means, but it gets you moving. So the fact that you're at home, you are moving less. So you need to complain and let them know that this is not right or good. And like Dr. Cadmore said, there are softwares even freely online that you could install on your computer that tell you. So maybe a good workaholic that will alert you after 1 hour, after 40, to say stop and take a break, and then you take a break and walk around. And the other thing is mental health. And I think Dr. Oyemi mentioned that, and I was happy he emphasized that quite a bit. But we are missing out on what this work from home is doing to us. We're missing out on the fact that there's benefit to this interaction we have when we go to work. There's a health benefit to that. And there has to be a deliberate effort now to ensure that people interact. That's why I prefer to say physical distance and social distance, that people have to make the deliberate effort to socially connect, to check on themselves, to make calls. Zoom calls don't have to be about serious business. It could be Zoom calls to say, I just want to see you. In fact, in this period, I do a lot of video calls, and I tell people, I said, well, it's my little way of saying I came to your house, since I can't come to your house, but now I can come to your house, I'm seeing your house, I'm seeing you. But the whole idea is to help people deal with the mental pressure that they'll be faced with.
All right. Thank you, Dubanjo. Thank you. I'll be taking a question from Francis Ogunlowo, and I want to direct the question to Dr. Lanre Ogunyemi. It reads, following the low death rate in Africa, do you think it is safe to open up schools and other public gatherings fully?
Yes, I think as I responded, I typed a response earlier, but to share that, I don't have a full understanding of the issues in Nigeria in terms of the low death rate. And we're not sure how much contribution there is that the school closure is bringing to it. I think there's so much we do not understand about this. And I understand the difficulty that governments might have in saying that people should go back to school. Here in the UK, the prevalence is much higher, and the governments have insisted on people going back to school because of the economic benefits of that happening. However, there is a lot of additional checks and balances that already exist here, and they have a better understanding of the finer things that contribute to increases or decreases in the virus prevalence, which we just do not have that in Nigeria. So I can understand the caution that governments have. So there isn't a clear answer to that, but I know that is a difficult one, a difficult judgment for politicians and to make. And I think it's worth empathizing with their position.
All right. So this is a similar question from Margaret, and it reads, with the second wave of lockdown being experienced in Europe and December as the earliest date for a vaccine, what is the implication for Nigeria as we resume our normal business operations?
Yes, my thoughts on that is that it's too early for one to be thinking of normality. Europe is experiencing its second wave of lockdown now. When the Spanish flu came around, there were several waves before things returned back to normal. Medicine has advanced quite a bit. One can treat, there's, sort of treatment to help with the symptoms of coronavirus. And there's the hope that a vaccine will come. But my best guess is that it's going to still delay normality for a long while in Nigeria. Certainly in Europe, I think the best expectation of normality is not for the next 6 to 8 months. And when the virus is manufactured, there's still going to be a huge logistical issue of getting enough vaccines to really all of the world. So it's really a long way coming, and we should sort of tighten our belts and keep preparing for the worst, I think. So I think uh, um, if you're making business decisions, don't expect normality anytime soon.
All right, thank you very much. Yeah, Dr. Odubanjo, I want to direct this question to you, sir. As regards the level of risk, where would you place teachers working with children in daycare school, or in day school rather? Where would you place teachers working with children in day school?
I think the risk is quite high actually, but I don't, when you use the phrase place them, but I would say they're at high risk. One, because you say it's a day school, meaning that there are children going in and out on a daily basis, where they're coming from, the homes and the situation at home you are unaware of, and also there are many of them, and also how do they get to school, and what's the risk of exposure along the way, either getting to or going back. So for each one of them, you are at risk of exposure to the virus through that individual. That is for every child in that school that you have to interact with. So the risk is quite high. However, it doesn't mean that it's an impossible situation. That's why the basics, even when we had Ebola in 2014, we had this kind of fear, and I mean, I had several experiences when I went to some offices and I just laughed. I go, if we do certain things and we do them well, the risk of catching anything is low, and those are all those simple things that we have been told, so if we do them, if we are washing our hands, if we wear the mask, as you should, so even as a teacher, you bear that in mind, you ensure that your classrooms are, where possible, quite rated. So if you're in some classy school in Lagos Island, this is not the time to encourage your air conditioning. This is the time to open up your windows, your doors, and ask for a fan instead. That the fan is better off for everybody. Yeah, so that you ensure there's good aeration and all that. So you minimize the risk, because sometimes you cannot eliminate the risk, like Dr. Guyemi pointed out. You try to minimize that risk, and that is really possible. Teachers are at high risk. Actually, I do know that when the NCDC, before the schools were open, there are no easy answers in all of these things, but I know that they did have a forum with the teachers union, with the PTA and all that. And the head of risk communication in the NCDC, we discussed at length. And he said when he was done, sharing with them, they actually said, don't open the schools. We don't want the schools to be open. We think we're better off at home. However, it's impractical. It's impractical if you even know how private schools operate, many private schools. That teacher will not even get paid. So as long as the schools are not open, the teacher doesn't get a kobo. And that is impractical. So you'll have to open sooner or later. And then when you do, you put in all of these measures, and you are going to be quite strict in ensuring those measures are in place and monitoring that people speak to them, because you understand that you are in a high-risk environment.
All right. Thank you very much. Another one is from Omowumi, and it reads, looking at the risk of infection of co-workers, would it be necessary for people to report their medical history with their employers if they've had infections, and how long after exposure or infection can a person return to work? Sometimes people are worried about stigmatizing or avoiding them. I lost that. But how soon do you think, is it necessary for people who have been infected to report to their employers? And how soon or how long can they start working? Dr. Odubanjo, thank you.
Actually, you owe it as a duty, especially if you are going to have to report to a physical location for work. You owe it as a duty to that institution and the colleagues at work, not just your employers, to report that you have been diagnosed, not suspected. You need to, even when you are suspected, actually because of our testing issues and how long it might take, you want to report that as well, to say, look, I'm suspecting this, or my doctor suspects this. The test is not yet out, but until then, I think it's safer that I stay home, and usually, so far so good, the research that's been done is pointing out that after about 7 days, people are not really infective anymore, which is why if you followed the the trend of events in Nigeria, after a while, used to be that people will have to have 2 tests if you are at an isolation center before you are discharged, 2 negative tests before they will send you home and say, yes, you are fine. But after a while, it got to where all they needed was about 7 days, and with or without a test, you could be sent home. Because now the risk of your infecting anybody else is believed to be next to nil. So in that period, however, of course, you will need your employer's consent to be able to come back in. And one of the best ways to ensure that is to have a negative test in your hands after whatever you've been through.
All right. Thank you very much for that response.
Sorry, can I just add to that?
Okay, sure, please.
Thank you. I think that's an excellent summary. There just a couple of things I'd like to add. The testing for the PCR testing, it can stay positive for up to 90 days. So you can have someone, as Dr. Dubanjo has just said, who is not really at risk of infecting somebody, but is still testing positive and positive. So as an employer, if you insist on a negative test, you'll be putting people away from work who could be at work, and will you just be lowering your resources? It's a battle that I've had to fight here with a number of employers to get them to accept people who might still have positive tests, but have been several days when they've been symptom-free, if that makes sense.
Thank you very much.
So once you've been clear of symptoms, you've had the first positive test, and then you've been free of symptoms for 7 days, go back to work. And don't bother with more tests.
Thank you, sir. There's a question here from Kemi Ogunyemi, and it reads, okay, the question is directed to the keynote speaker and the panelists, but I would prefer you answer that, sir, Dr. Nari Ogunyemi. I am particularly interested in the occupational health impact of the work from home situation on employees. We are all hyper exposed now to tech comms media, both in terms of intrusion into homes and in terms of screen time. What are the risks of extra work stress, sedentary work, hearing loss, sight damage, cancers, etc.?
I think that's quite a broad thing, and it sort of cuts across practically all of my occupational medicine expertise. But for working from home has been a new challenge for a lot of industries. So they're having to, remember what I mentioned before about the risk assessment, people are having to develop risk assessment checklists as well for people who are working from home. So we will be providing guidance to employers about how to make sure that someone who is working from home is not putting their health at greater risk with regards to whether it's the mental health aspects, but also the screen time aspects, which I think Dr. Dubanjo touched on earlier, as well as Dr. Cadmos. In terms of taking regular breaks from the screen. A practical thing as well, with that is, at work, quite often you have a workstation that's set up properly. That can be very challenging when you just have to work from home. So I'm seeing people with different musculoskeletal concerns, because whereas they had an office before, now they're having to have a laptop in their bedroom and type until odd hours of the day because they don't have a proper workstation. I haven't seen the hearing issues yet, probably because the lockdown has not been long enough, but I expect that with time, you will be getting all kinds of stress and strains from that. But just like we would as occupational physicians, we would look at any workstation that we have to advise employers on. The paradigm now has to shift for employers to start looking at the employee's home and doing a proper assessment of the work environment in which the employee is working, just like I will do if the person was at work, to see what other risks might be in that work environment. And the tool that I am using to help my the companies I advise is for them to look at it just like any other workstation and look at all the various risks to say, okay, is there any particular physical risk here in this particular environment at my home? Are there any chemical hazards? Are there any other emotional hazards? Are there biological hazards, etc.? So I would tend to look at that and then deal with each issue on its own merits. But the key thing is a risk assessment of the home work environment as well.
All right. Thank you very much. I hope that answers your question, Mrs. Oguyemi. Yeah, so on this note, I would like to thank everyone for their participation, most especially our speakers for their time and for sharing their knowledge with us on this webinar. I also want to thank the audience for their participation. You've actually made this event worthwhile. Now I'll be handing over to Akuna to round up the event. Akuna, please.
Okay, thank you. I'd just like to say a big thank you to our speakers for your insightful address and discussions. I know I gained a lot and I hope we all did as well. Thank you, Sophia, to our moderator for managing this event so well and keeping everybody to time. Thank you to all our participants as well for taking time out of your busy schedule on a Monday afternoon. I know how that can be to make time for this. And it's our hope that you gained a thing or two from this lecture, and we hope to see you in subsequent events as well. So thank you to everyone, and this concludes this event. Thank you and good night.
You're welcome. Thank you.
Thank you.